Hey guys, so today we're going to be talking about hip health and hip pain in general. So one of the most common issues that we see is a lot of people have a lot of hip tightness and pain coming right through their hip joint there. It's very common. For the main reason for it is because of lack of glute activity. Of course, we have very long commutes here in Toronto. At the same time, when we're sitting all day, every day at our desks, the only movement we really get is with our upper body, shuffling and moving things around. So it's also very important to get up and move around whenever you can so we can keep our legs and hips nice and healthy at the same time. For females, most commonly, it's when you're crossing your legs for long periods of time. You're shortening one side while we're stretching another. So it is very important to keep both of your hips nice and even. Now, the three main muscles that are going to go into spasm or become very tight when we're sitting down and not having that glute activity is one, your iliacus, which is located on the inside of your ilium, which is another word for your hip bone that pops out in the front here. Secondly is your tensor fasciae lata, which is located on the outside of your hip, which runs down close towards the knee. And then your psoas major, which goes from your lower back up into the inside of your thigh, or your greater trochanter area there on your femur. So when those muscles become very tight, it's really pulling everything in that joint area. So what we're going to do is we're going to go over some ways to get that glute activity and some exercises and some stretches in order to make sure that your hips stay nice and healthy. Okay, so the first thing that we're going to do is work on our glute activity. So here I got my resistance band. So I'm just going to lay on it and feed my leg through it to get some good resistance on it here around my foot. So the first thing I want to do is start drilling my knee into the mat as hard as I can. So I'm pushing right down here as hard as I can. And then I'm trying to lift with my leg straight up with my heel pressed against the resistance band. I have some pretty good resistance on it for a couple of seconds, and then back down to the ground and up again. So I'm going to repeat this a few times on each leg, and this should really bring the glute activity back. So what you should notice is the more repetitions that you do, your leg and your thigh should actually lift higher off of the mat. Now, if it doesn't happen, that will indicate that your glutes aren't firing off properly. But if it is, then the exercise is done. Okay, so next we're going to stretch our tensor fasciae lata. Now, that's located on the side of your hip. It's kind of like a triangle muscle right here. What it's responsible for is abduction of the hip and the leg here. So what abduction means is bringing it away from the midline of your body. So we're going to try and stretch that out right now. So what we want to do is get into a similar stretch how we're going to get into for our psoas major. So we're going to start off in a lunge position here. I'm going to show you sideways in a second. But instead of going forward, we're actually going to move backwards here. So remember, your leg always wants to kick out. So when we push forward, your leg naturally wants to kick out, so you won't actually stretch the muscles that you're intended to. So what we first want to do is actually lean back, and then we're going to cross one leg over the other. And if you feel a stretch right here, that's perfect. But if not, then we're going to come back forward and rock forward. Okay, you might find this a little bit shaky, a little bit hard to do, so if you have a bench to hold on to or a chair or something next to you, that'd be perfectly fine. So one thing we want to make sure is that when we're doing this lunging stretch, is that our hips start stacked over one another, right? You don't want to be already stretched out here and then try and do an exercise. You might cause a little bit of pain and too much overstretching. So we want to make sure we're nice and at 90-degree angles here, everything is stacked over one another. So again, we're going to lean back, we're going to cross one leg over the other, and then again lean forward. Now if you feel that stretch already, then perfect, you can stop right there. Okay, now psoas major. Now that's the muscle that's located from your lower back into your greater trochanter area onto your femur here. Now this is the most common muscle that's going to be the most tight from sitting down for way too long. Now all of these collectively are going to get tight just because of the way that they support the hip, but your psoas major might get the majority of the pain here. So again, we're going to get into that lunging stack position here where our legs are right over our joints. And then instead of going backwards this time, we're going to go forwards, and we're really going to try to dip our hips down and get a nice stretch coming right over top of the hip. So we're going to try and hold this for 10 to 15 seconds in the beginning when it's pretty painful. As your stretching becomes a little easier, it's a really good indication that your hip joint is becoming more healthy. So continue to do it more and more, right? The more that you do it, the longer your stretches you should be able to last. If you can get up to 2 or 3 or even 5 or 10 minutes for a stretch, there's no limit to it. So you should really be stretching your joints till it gives you relief, and then afterwards as well. You have to remember, you can always fall back into these problems, into these issues from sitting down for a long period of time because our lifestyles don't change that much when we're at work or commuting in a car. So you have to also maintain these stretches for, you know, weeks and maybe years to come if you do have this kind of a lifestyle. All right, now your iliacus. So your iliacus is located on the inside of your ilium. This bone, bone that comes out of the front of your hip here is called your ilium. So collectively, with that and your ischium and your pubis, it will make your whole pelvis together. So your ilium has a muscle on the inside, and it is also responsible for all the hip flexion. So all of these muscles are responsible for bending the body forward and bringing the leg up and the hip up here. So we're putting flexion into the body. So this is why, mainly, if we're sitting down for a long period of time, these muscles are going to get tight because we're keeping them in that locked position. So, you know, over hours and weeks and years and things, they're just going to seize, basically, right? So you need to stretch them and make sure they're exercised. So your ilium is going to be really uncomfortable to stretch. So I'm just going to warn you guys before we start doing it. If you don't feel comfortable doing this, then just ask your physiotherapist or an athletic therapist or anybody who you see to try and help you stretch this out. So what we're going to do is we're going to lay on our back, and our legs are going to be forward, or sorry, they're going to be extended. So what you want to do is you want to kind of make a fish hook with your hand, and you're going to go right over top of that bone, and you're just going to fish hook right inside and trying to get as deep as you can. So it's going to be really tough to penetrate, especially when you're doing it and if you're talking as well, because I'm flexing my diaphragm and my abs here. So if you have someone who can help you out, this is a lot better. But what you want to do is try and take a really big deep breath in and then let it out. As you let out, you're going to want to try and drill your hips deeper and deeper inside. You really want to try and stick to the wall of your ilium as well. You don't want to just push straight down. You want to really curl inside and fish hook right inside of that ilium. So I'm using my other hand to reinforce and push here. Once you get as deep as you can, you're just going to relax, just try to breathe. And if you can, push down deeper and deeper with each breath, you're going to do that. But if it doesn't go any further, just hold it there for as long as you can. If it feels too uncomfortable, then you don't have to do this on your own. Just ask your therapist to help you out. So there's a couple of really great exercises that I like to do to make sure that the muscles stay nice and fit. So, you know, when your muscles are fit and they are not tight, your joints will essentially, they will stay nice and loose and you'll be pain-free. So what I've done here is I've already attached the resistance band to the squat rack here. So I'm just going to step through and make sure it's nice and high on my thigh here. So again, I'm going to get into that lunging position. And if you don't have a resistance band, you can just do this on your own without. So we're essentially going to get back into that stretch where we're just going to rock forward and then back. So you want to stay nice and controlled. You don't want to just drop your hips down and rock back like this. So you want to make sure you maintain good posture into your hips and your lower back. So we're just going to go forward. I got some resistance on here and then back. So you can do this 10 to 15 times. If you feel a lot of burning or any pain, you're going to stop before that. And then also remember, on a scale of 1 to 10, if you're feeling pain around like 1 to 4 and 5, it's okay to like push through. But anything above that, you're going to want to take a little bit of a break. So the next exercise is called the clamshell. So what we're going to do is take our resistance band again. We're going to step through, come lay down onto the mat. So we're going to keep our legs bent here. We're going to keep our feet stacked over one another. So resistance band is really pulling on my thigh here, giving it some good resistance. So I'm going to lay down, and then I'm just going to open and shove my leg here just like a clamshell would. So you want to do this again 10 to 15 times to keep your hip in good health. So, you know, if you're having trouble keeping your hip in good health, and if these exercises aren't helping and these stretches aren't making a difference, then make sure to go and see a physiotherapist in order to make sure that your hip feels better. So the last recommendation I'd have is to foam roll, especially on your quad and your IT band, tensor fascial lat on the side there like we were talking about. If you don't know how to foam roll, there's other videos that I have out there that show you how to foam roll properly for your legs and your lower back. So if you have any other questions, just give us a message and we'll be sure to answer.